All right, I got my coffee. Did I push record? I'm ready to go. All right. Welcome to the Eat Your Greens with Dr. Black podcast, where we talk about evidence-based habits that you can start doing today to improve your health. Instead of the Eat Your Greens with Dr. Black podcast, today I'm calling it the Get Your Z's with Dr. Black podcast because this episode is all about sleep. I did a short fun facts style episode a while back. I think it was maybe in season 1. I've been wanting to do a follow-up episode ever since then because I really don't think that many people realize just how crucial sleep is to our overall physical and cognitive health, or even how quickly sleep deprivation can take a toll. Now, speaking from personal experience, this is something that I am acutely aware of. And when I say personal experience, I don't mean that in an abstract way like pulling all-nighters way back in college or medical school back in the day. If I remember correctly, I think I actually had a 36-hour shift once when I was on the trauma surgery rotation as a medical student. Let that sink in. Many people work a 40-hour work week. I had a 36-hour straight shift with little to no sleep. And that's just one of many reasons why I'm not a surgeon. But no, for this episode, I'm talking about the present day, in real time, direct experience. Let me explain. I have what I like to call extrinsic insomnia. Yes, I just made that term up. I've never actually seen it in a medical textbook. Extrinsic means outside of the self or external factors. So regular listeners have heard me talk periodically about my special needs daughter. She has a genetic epilepsy syndrome, and we happen to be going through a bit of a rough patch with increased seizure activity. Hers tend to happen mostly at night, so right now I'm either sleeping with one ear open, waking up at every little sound on the monitor, or I'm actually getting up to take care of her during a seizure. It's a lot like having a newborn baby, but we've been doing this for like 23 years. So she had a few rough nights in a row, and I am really feeling the effects. You might be able to hear it in my voice. It's a little scratchy. Maybe not, because the post-recording audio processing might take care of a lot of that, but if I sound a little rough around the edges, you'll know why. Also, I didn't dig deep into the research for this episode. I'm not going to throw a bunch of statistics and biology at you. I'm just going to review a few of the more common ways that even 1 or 2 nights of poor sleep can affect you. I'm going to talk a little bit about self-care, and I'm going to give you some health-made doable style strategies that might actually help you get a better night's sleep, assuming you have more control over it than I do. All right, well, let's start with some of the common evidence-based effects of sleep deprivation, because it turns out it's more than just feeling groggy or grumpy the next day. Although, yes, there's that too. In fact, mood changes are the most common and well-recognized effect. We've all been there. You feel irritable. You have a lower frustration level. You're more emotionally reactive, right? You're snapping at your loved ones or your coworkers. For me, loud sounds and chaotic environments are super annoying. When I'm really tired, I just can't tolerate that kind of environment. And I've been known to wear noise-canceling headphones even around my house. What else happens? Aside from being an absolute, shall I say, witch, because this is not an E-rated podcast, a night or 2 of poor sleep also significantly impairs your brain and your nervous system. When it comes to the brain, we have impaired attention and reaction time, so that's slower response times. At the extremes of sleep deprivation, it's very similar to intoxication from alcohol. We make more errors, and there's a higher risk of accidents like car wrecks. And I think I mentioned this in that initial podcast episode, but high schools with a later start time, so the kids are able to sleep in a little bit more, actually had fewer student deaths from car accidents. There's something called executive functioning that our brain does, right? That's our ability to plan, make decisions, stay organized, and our ability to be discerning or judge situations. And that is also affected by sleep deprivation. We're more impulsive. We may not make good choices, especially around food. And I'm going to get into that in just a bit. But when you're really tired, when you're sleep deprived, this is not the time to try to make major life decisions or even decide on big purchases. Our short-term memory can even be affected. We have reduced ability to form new memories. That's the part of the brain called the hippocampus, and it's affected directly by sleep deprivation. And this is why pulling an all-nighter to study for an exam is a terrible idea. You will literally remember less. Just go to bed. Another medical school memory, I was studying for the hematology exam, specifically the clotting cascade, which is really basically a lot of memorization of this complex chain of reactions that leads to a blood clot. And that might be the worst grade I ever got on a medical school exam because I tried to stay up all night the night before trying to memorize that clotting cascade. So, anyways, never mind. Now I'm just rambling. See? Sleep deprivation. When we move outside of the brain into the rest of the nervous system, loss of sleep increases something called sympathetic tone. So the sympathetic part of the nervous system is that fight or flight response. So your nervous system basically goes into crisis mode and it's ready to either fight or flee. And as a result, you're going to feel more on edge and stressed. And if you're already prone to things like anxiety or depression, it's going to really ramp that up. Chronic lack of sleep is very strongly associated with higher rates of depression and anxiety and even suicidal ideation. If that describes you, please get some help. When we're sleep deprived, we also have a lower pain threshold. Like everything just hurts, and I can definitely attest to that. I have this minor arthritis in my thumb, and that's been acting up, and then like my hip hurts. I'm thinking like, did I pull a muscle? What the heck is going on? Everything just hurts. Now, for people with an actual chronic pain condition, you end up with this cycle of interrupted sleep where the poor sleep causes worsening pain, and then the pain interferes with your ability to sleep, and so on. It can be a big problem. Moving on to other effects in the body, even a couple of nights of interrupted sleep can actually affect your immune system. You have reduced activity of the function of a variety of cells that are going to fight off infection. So you're more susceptible, especially things like common cold or flu or COVID. And there are measurable changes in your immune system's ability to respond even after one night of bad sleep. Personally, I'm relying on my super well-developed immunity after decades of practicing general pediatrics. You know, my patients tend to actually slobber on me, throw up on me, cough on me. So my immune system is super well developed, and I'm hoping that that's going to keep me safe. Did you know they're actually now recruiting pediatricians to donate plasma to harvest our antibodies because we have such well-developed immune systems? So, all right, never mind. I'm rambling again. Sleep deprivation also impacts your metabolism and a number of your hormones. Have you ever noticed that you crave the carbs after a night of bad sleep? You're not imagining things. Increased cravings for high-calorie, sugary, ultra-processed foods are a known phenomenon. Basically, like I said, your brain is working in crisis mode, and it's going to drive you to seek out quick sources of energy. You're actually going to feel more hungry during the day because the hormones that affect your appetite have been changed. You have an increase in the hormone ghrelin and a decrease in the hormone leptin. I talked about these hormones in my episode on why extreme diets actually lead to more weight gain in the long run. Ghrelin is made in the stomach and it signals hunger, whereas leptin comes from your fat or your adipose tissue and it signals satiety. It tells you when you're full and you've had enough. So increase in ghrelin, decrease in leptin. This is going to make you feel hungrier and you're more likely to overeat. There's also an impact on your insulin sensitivity, even after 1 or 2 nights. So this makes it harder for your body to use all of those carbs that you just ate. It raises your blood sugar, and that's going to be bad for people who are already affected by maybe prediabetes or actual diabetes. So some other hormones also get altered. There's an increase in cortisol levels. That's the stress hormone. And there's a decrease in growth hormone secretion. Now, you might be thinking, hey, I'm an adult. I'm done growing. Why would I care about growth hormone? Well, it turns out growth hormone is important for things like tissue repair and preserving lean mass, and even promoting lipolysis or fat breakdown. So, what does that mean? With chronic sleep deprivation, it might take you longer to recover from illness. So, you're more susceptible to it in the first place, and then it takes you longer to recover, or it takes longer to heal from an injury. You're actually going to store more fat and maintain less muscle. And yeah, nobody wants that, right? Sleep deprivation also affects your heart. That increased sympathetic tone that I mentioned earlier raises your blood pressure, and that puts more stress on your heart. It also affects something called your heart rate variability, or HRV. Now, this is a marker of physiologic resilience, or whether you can bounce back from stress. The time between heartbeats should vary, sometimes a little bit longer, sometimes a little bit shorter. And sleep deprivation reduces this variability. So basically, lower HRV means that your body just isn't as flexible. It doesn't handle stress or recover from it as easily. And then finally, circling back to seizures, even one night of sleep loss can lower your seizure threshold. Now, if you actually have epilepsy, that's going to mean an increased frequency of seizures. In fact, sleep deprivation is used to help diagnose epilepsy on EEGs. If you're scheduled for a routine EEG, they're going to ask you to not get much sleep the night before. And that's going to help bring out any abnormalities on that EEG tracing to help them make the diagnosis. But here's the thing. You don't have to have a seizure disorder to have a seizure. Any brain, if it is stressed enough, can have a seizure. And sleep deprivation sometimes is enough to trigger one in some people. So the classic example is a otherwise healthy college kid who pulls an all-nighter, or maybe they're partying too hard and they have a seizure. They don't have epilepsy. If they take care of themselves and get regular sleep, they're not going to keep having them. Now, I could keep going. Sleep deprivation literally affects every part of your body. They've even documented changes in things like the gut microbiome after just 2 nights of partial sleep deprivation. And that means like 5 or 6 hours of sleep. Yes, you can measure changes in the health of your gut microbiome. Now, if I start talking about that, we'll be here for another hour or two. So I'm going to leave it at that. Let's move on to what you can do the day after to protect yourself and those around you. So number 1, just keep it simple. Lower the bar for the day. Focus on essentials only and try to remove anything you can from your to-do list that doesn't just have to get done. This is not the day to try to optimize your life. I'm reminded of a poem by one of my favorite poets, Mary Oliver. It's called Today, and it starts out, "Today I'm flying low, and I'm not saying a word. I'm letting all the voodoos of ambition sleep." I'll put the entire poem in the show notes for you because it's just lovely. So avoid making big decisions if you can. As I said, sleep deprivation affects our judgment and our impulse control. Avoid major choices, difficult conversations, or basically anything that's high stakes. Just avoid it if you can. Now, you're going to expect those mood changes, right? We all have that. You'll be more irritable, reactive, and less patient with those around you. This is just physiology. Don't beat yourself up about it, but do be intentional about how you show up. Try to pause before reacting. Check in with yourself. Give yourself a little more space before responding to people. It's probably a good idea to just let the people around you know, hey, I didn't sleep well. I may be a little off or grumpy today. And if you do overreact to something, be sure to apologize and then forgive yourself. You're doing your best. I also want you to take time to actually nourish your body. I just talked about how sleep deprivation affects your stress level and your appetite hormones, driving you to binge on those high-carb processed foods. So make a point to eat a healthy breakfast that will leave you feeling satisfied and will support a steady blood sugar throughout the morning. For me, that was a whole grain seeded bagel with hummus and microgreens. And it was easy, it was quick to make, and it gave me that mix of whole grains, fat, and protein that will sustain me until lunch. Now, to counter some of the more pro-inflammatory effects of my sleepless night, I also added a side of mixed berries. And for lunch, I'm including an extra helping of my favorite, broccoli, for those antioxidants. I'm also going to make a point to avoid my work break room, my office break room at all costs, because there's almost always cake or some other dessert in there. And I know I probably won't be able to resist. Another thing you can do is get some sunlight first thing in the morning. This helps to set your circadian rhythm. Go outside without sunglasses. Even if it's cloudy, there's enough sunlight to tell your brain, specifically, if you want to be nerdy about it, the suprachiasmatic nucleus. It basically sends a message to your brain that it's time to be awake. This also helps to release melatonin the late evening so you can fall asleep more easily the next night. You can also try going outside right after lunch for a little early afternoon sunlight pick-me-up. If you must nap, do it in the late morning or very early afternoon and keep it short, maybe around 10 to 20 minutes, just long enough to refresh your brain, but not so long that you wake up extra groggy or messes with your sleep later that night. These tips are also really good for recovering from jet lag if you've been traveling. Now, there is another technique I want to mention that might help you feel more rested and recover after a bad night. And this comes from a scientist out of Stanford, Andrew Huberman. You may have heard of his podcast. It's super famous. His technique is called non-sleep deep rest, and you can find it on Spotify and probably YouTube. It's basically a deep breathing exercise paired with a mindful body scan, and he claims that this helps the brain recover from sleep deprivation. So he has several podcasts on the science behind it. Like I said, I did not do that level of prep for this episode, so I really can't tell you more about it. I will tell you that I did his 20-minute non-sleep deep rest session during my lunch break, and I think it actually did more for me than that dark chocolate raspberry oat milk mochaccino with an extra shot that I picked up on my way to work. So I don't know if it was the non-sleep deep rest specifically, or if it was just taking 20 minutes to turn off my computer and my office light and do a relaxing mindfulness practice. Whatever, it doesn't matter to me. I felt better afterwards. I will put a link to that in the show notes. Give it a try and let me know if it helped you too. Now, even better than recovering from sleep deprivation is preventing it in the first place. Am I right? So what are some things that you can do to improve your sleep if you're not suffering from that, quote, extrinsic insomnia like me, meaning there's not some external factor disrupting your sleep? I'm keeping it simple here. I'm not going to go into all of the things that are recommended to help you sleep. I'm just going to review a few of the basic evidence-based strategies. So first and foremost, be strategic with caffeine and alcohol. I know I said that I got an oat milk mochaccino with an extra shot on my way to work, but I did make sure to stick to caffeine-free herbal tea and water for the rest of the day. Whenever possible, cut off caffeine at least 8 hours before bed, earlier if you're someone who's sensitive to caffeine. And alcohol, now you may be tempted to have that glass of wine in the evening to help you wind down, but here's the thing. Alcohol might make you feel sleepy initially, but it actually disrupts sleep later in the night. So you're going to end up with worse sleep in the long run. So basically just avoid alcohol as much as possible, but that's true whether you're sleep deprived or not. Now, you've probably heard this one before. Protect a wind down window. Create a 30 to 60-minute buffer before bed. Dim your lights, reduce stimulation, avoid work or emotionally charged media, conversations, things like that. You want to just send a signal to your brain that the day is ending. It's time to relax and get ready for bed. You could even try taking a hot shower because the process of warming up in the shower and then cooling down after the shower actually promotes sleep. Now, as much as possible, on a routine basis, keep a consistent sleep and wake time. Did you know that your wake-up time may actually matter as much or more than your bedtime for promoting quality sleep? Sleeping in on the weekends may be doing more harm than good. Try to keep your bedtime and your wake times within about 30 to 60 minutes every single night, even on weekends, to stabilize your internal clock. There's this thing called social jet lag, and that's when your sleep schedule shifts between work days and weekends, like staying up later and then sleeping in on the weekend. So your body feels like it's traveling across time zones twice a week. This doesn't mean you have to give up your social life. The occasional late night out won't be a problem. It's only a problem when it's a consistent pattern. So try to be as regular as you can about when you go to bed and when you get up. Another technique to promote good sleep is called stimulus control. This is a core principle of something called CBTI, or cognitive behavioral therapy for insomnia. Basically, you're training your brain to associate being in bed with falling asleep. And that means you only use your bed for sleep or intimacy. Don't read, don't watch movies, don't binge social media, work on your computer, whatever. Don't do anything else in your bed except sleep. So do these things elsewhere in your house. Now, if you're trying to go to sleep, you've been lying in bed awake, the mental wheels are spinning, and you just can't fall asleep, actually get out of bed. Go sit on the couch or someplace else in your house. Do something really low stim in dim lighting. Maybe journal or color in a coloring book, draw, crochet if you know how. Do this until you feel sleepy again, and then try to go back to bed. Eventually, your brain is going to associate being in bed with falling asleep. Makes it a little easier. And then, just to emphasize its importance, get some morning sunlight. What you do in the morning is as important as what you do in the evening when it comes to promoting quality sleep. Aim for a minimum of 5 to 15 minutes of outdoor light within an hour of waking. Longer if it's overcast. Don't wear sunglasses or a wide brim hat. Gaze at the sky, not directly at the sun. All of this is going to help set your circadian rhythm, making it easier to fall asleep at night. If going outside just is not possible, even gazing out a window can help. Now, one little caveat, if sleep problems are more serious or persistent, consider getting some help. Talk to your doctor if you suspect conditions like obstructive sleep apnea or any other underlying health condition that's keeping you awake. For chronic insomnia, look for a therapist trained in that cognitive behavioral therapy for insomnia, CBTI, because this has been shown to be the most effective first-line treatment for chronic sleep problems. Sleep is one of the fastest ways to impact your health, for better or worse. Even partial sleep deprivation, like getting only 5 or 6 hours of sleep on a regular basis, can be detrimental. So protect it whenever you can. And if you can't, adjust your expectations and take good care of yourself the next day. If sleep problems are ongoing, don't ignore them. There may be a real solution out there for you. Personally, Sarah and I are going to bed early tonight, and I desperately hope that she has a better night. We'll be seeing her neurologist later this week to see if there's anything we can do to get her seizures back under control, so please wish us luck. Thanks for being here, and don't forget to eat your greens.